Good day and welcome to the Mayor's Corner. Today's guest is Michael Widmer from the Massachusetts Taxpayers Foundation. Michael is possibly the preeminent budget scholar in the Commonwealth of Massachusetts, somebody we all rely on for numbers, and that's never been more important. Michael, welcome to Methuen. Thank you.
Glad to join you, Mayor.
Thank you very much. Let's get right into this. Quickly, what is the Massachusetts Taxpayers Foundation?
We're an independent, nonprofit public policy organization. We're supported by employers. Over the years, we've earned a lot of credibility because of the quality of work we do, the independence. We try to present common sense commentary on state finances and municipal finances.
Right. Well, I mean, I don't want to get you in trouble, but you're independent, and common sense often isn't a welcome commodity on Beacon Hill.
That's often the case.
That's often the case, especially with numbers. Well, let's get right into it, because as a mayor, you know, I'm looking at not only what comes back in local aid, but how they get there. And I know that you, in the last few weeks, were up talking about consensus revenue. What is consensus revenue, first off, and then let's talk about what the actual numbers are looking like.
Sure. The consensus revenue is an agreement by the head of the House Ways and Means Committee, the Senate Ways and Means Committee, so the chief fiscal people for the House and Senate, and the Secretary of Administration and Finance for the governor, so the fiscal leaders of the state, the three bodies. They hear testimony from experts like myself on economic and revenue projections, and then they agree on a consensus revenue estimate for the next fiscal year, fiscal 12, beginning July 1, around which they can build a budget. Now, I should say it wasn't always that way. 20 years ago, Beacon Hill built their budgets around what they wanted to spend,
right,
and then they estimated revenues that they hoped came in to meet that spending. This was, in fact, a major reform 2 fiscal crises ago, and it has stuck for 20-some years, and it's been a very important thing.
Let me just stick with that, because I know that even though it is a step in the right direction, if consensus revenue obviously is estimated too high, that's not a good thing. And I know that your estimates haven't always been accepted on Beacon Hill in terms of an exact number, and I know a couple of years ago, I think that maybe they came in a little bit high. Is that correct?
Sometime, yes. That certainly was a couple of years ago. They estimated revenues too high, and of course, I mean, we and others had said the economy is going to head south, so to speak, right, and none of us knew we were going to end up in this global recession. But nonetheless, storm clouds were there, so they had to adjust their revenue downward. This year, as it happens, revenue that they came up with just the other day is virtually identical to our forecast. Right. And revenues are improving each month, and they've improved in December, which followed the hearing that took place. So we think that that's a conservative, our forecast, and the one they're using now is conservative, so it might be a little low rather than too high. So I think there have been some sins in the past, but I think looking ahead to fiscal 12, this is a reasonable estimate.
Well, let's then talk about the year we're in now. Yes. And the revenues I know are up. I mean, what is the in this fiscal year? What have the revenues look like? And I know they're over benchmarks.
They are, and revenues are growing about 5% this year, which isn't bad coming out of this recession. Better than many states, maybe most states. The problem is we are above the benchmark by about $750 million. But our spending is above the budget by $750 million or thereabouts. Right. So we're not seeing any additional revenues other than maybe $100 million to go into the state's rainy day reserves that could help us next year. So the good news is we're getting better revenues. Bad news is we're spending it.
Well, you know, I had in my notes here, I had wanted to talk to you about a specific subject, but now that you mentioned the increased revenues in this year and the additional spending, there were 2 supplementals.
Yes.
And both seem to be heavily weighted towards additional spending in Medicaid.
Correct.
And so how do we get out of this spiral? Because it's almost $1 billion that we're talking about in additional spending on Medicaid. And I realize that it's medical spending inflation and medical spending. But as I look at it from the outside, it doesn't appear to me to be sustainable.
It's not sustainable. To give some context, this is a $10 billion item, roughly, in a $30 billion budget, so 1/3 of the budget. Now, half of that $10 billion gets reimbursed by the federal government, so it's not quite as bad as it looks. But it's $10 billion growing at 7, 8, 9, 10% a year. You're correct, it's almost an additional $1 billion in spending for this fiscal year beyond what was budgeted. The problem, of course, is twofold. One is medical inflation, and so this program is not immune to that. Secondly, caseload. I mean, this is for low-income seniors and disabled, and whenever we hit recessions, then the caseload goes up, and so we've seen a lot of people flock into the Medicaid program. Now, what do we do about it? Every state, almost every state in this country, is trying to answer that question, and no one has found an answer.
Right.
And that's the problem. And I don't have an answer because most of these programs that are offered are, in fact, required by the federal government, except for a few things where you can save a few dollars, but not a lot. So looking for savings in Medicaid is an extremely difficult thing. We've already cut payments to providers, to hospitals. They're getting 70 cents on the dollar, local hospitals
Yes.
who treat Medicaid patients. So we're hurting local hospitals. And we still have this problem. So yes, it's unsustainable. What do we do about it? Not clear.
Right, right. And I know that quite clearly that is the case. The caseload is way up. I don't know, are you involved at all relative to looking at prescriptions for, I'm a little off subject here, but medical savings in terms of switching to a global payment system, for example? I mean, have you
Yes.
looked at that, and does it have any potential?
We are part of those discussions about changing from a so-called fee-for-service to basically paying for an individual for covering for a year, whatever his costs are, as a total budget, a global payment. Yeah, that may save some money. It may help in quality because the patient's treated as sort of in a more coordinated fashion. Dramatic savings? I doubt it. Yeah. I doubt it. I've been around long enough to know that these changes in payment systems can be helpful and whatnot, but I don't see that as any major opportunity. I think we should move in that direction. We are moving in that direction, but it won't solve the Medicaid problem or the healthcare inflation problem in and of itself.
Yeah, in and of itself. Okay, so we talked about this year.
Yes.
Let's talk about next year. And I know you went to the hearing on consensus revenue. I know that your estimates are that there's going to be a nice little bump in state revenues.
Yes.
But when you listen to the Mass Taxpayers Foundation yourself, you still talk about, despite the increased revenues, a big hole, $2 billion hole in the state budget. Why is that?
Yeah, that's the key question because it's really counterintuitive. Economic recovery, not dramatic, but we're getting additional revenues. Isn't the fiscal crisis behind us? The simple answer, and it really is largely this, we are using $2 billion in one-time money to balance this year's state budget. Mostly federal stimulus dollars that have come to states across the country to help balance their budgets. Now that's a good thing because that means we haven't had to make even more cuts. On the other hand, we're running out of the one-time money. It's no more federal stimulus dollars after this year. So we have a $2 billion hole going in. We may get about $1 billion in revenue growth, but then we have $1 billion of other costs that are like Medicaid that are impossible to control. So there is no way the economy is going to grow enough to make up for this huge one-time money. And that's the problem facing state leaders in fiscal 12, and it's why we're going to have significant budget cuts when the governor unveils his budget next
2 weeks.
Days, 2 weeks.
Next 2 weeks,
Yes.
yeah.